have a party. It is a party in this place today. All right. Resources that you're going to want to look at if this is an area of concern is this Dr. she's a medical doctor, and she actually wrote this book, Is Your Cardiologist Killing You? She's an MD, so it came from her. And then the other thing that she wrote, she's got 2 other books in here that are fantastic. And one of them, they're in Spanish and English. One of them is called The Cholesterol Hoax, okay? So some stuff that you're gonna hear today, it's gonna, this would be a good resource for you. And then the high blood pressure hoax is another thing that she talks about today as well. So, or that I'll get into, but this is one of her books. The other doctor, I don't know if you guys have ever heard of, I'm going to kind of refer to him later in the talk, is Dr. Wolfson. Have you guys ever heard of Dr. Wolfson? He's out of Arizona, and he is literally the foremost expert in this entire arena. And so I highly recommend listening to his podcast, and just, if this is an area of concern, like before doing a procedure, we've sent people to see him in Arizona. I mean, just an amazing guy. His wife happens to be a chiropractor, so I like that too. And he's got a few rules that we'll hit at the end that he really says that people really need to follow. It's like the 10 commandments of having a healthy heart. So we'll hit that as well today at the end. So what is the world's #1 death-causing disease? Right, heart disease. So does everybody know what number 2 is? Cancer. So those are going to be the diseases. But the things that kill, the number one thing that causes the most deaths every year in the United States is what? Do you guys know that? He says stupidity. I love that. It's actually, which this, I don't know, this is really stupidity, but it's actually medicine. Some of it's stupidity, right? Some of it's just ignorance. We just don't know better, right? So that's the kind of stuff that you're also really just want to be aware of. We want to change the way we view and manage our health. And in this place, I'm going to challenge you to think a little differently and look, eyes to see, ears to hear. Just look at things very differently than what maybe you're hearing out there, what you're being told. So one of the first myths that we're actually dealing with is heart disease is normal with aging. If you say that to yourself, you really need to cancel that. You just need to cancel it. Heart disease is not normal with aging. It's what? It's common, right? It's common. We see it's common with aging, but it's not normal. And so you really, again, you just want to cancel that. In my particular family, we have a lot of my family members on my mom's side have dealt with ruptured aneurysms. Do you guys know what that is? So blood vessels completely burst. And so we found several of our family members dead on the floor because a blood vessel had broken. I'm going to talk to you about some of the things they were doing, not knowing any better, that caused and kind of led to that situation to happen. And so that's something I take very seriously. That's in my family on this line. But how many of you know that genes load your gun, right? But lifestyle pulls the trigger. I'm going to say that again. Your genes load the gun. So my family history, of having blood vessels rupture are the genes loading the gun. But if I don't live a life of the 5 essentials like we teach in this office, then it's my lifestyle that will cause that disease to manifest. You guys with me? So no matter what it is in your family, you just want to keep that in mind. Bruce Lipton actually talked about that in his book called The Biology of Belief. That's his quote, genes load the gun, lifestyle pulls the trigger. And he talks about how 96% of all diseases are preventable. And that's because of, this whole lifestyle thing that we pull the trigger on things. So the stats look like this: 1 out of 3 deaths in the United States from, heart disease. There's actually 1 death every 38 seconds. That's pretty scary. 1 death. That's the person that hits the floor, right, and doesn't get back up. That's the heart attack thing. They hit the floor and don't get back up. There's, and we're bankrupting our healthcare system just with this particular situation alone, 1.1 trillion by 2035. Like, we can't sustain that. And this is the most disturbing stat, the bottom one. Disturbing to me, okay? Atherosclerosis in 100% of kids under the age of 10. We're in stage 1 where we have fatty streaks that we're finding in kids under 10. Why? Anybody know why? What are some things? Food, but what? Okay, so 1 to 2 during the school year meals are being eaten where? Right. So we're in a hurry and we're sending our kids off to school and we're hoping that they get something there that fills their belly. But we've got to revamp that whole system. My heart's desire is to get into these schools and really make a change in how they're educating the kids, number one, first, the teachers in the school, you know, and the administrators at the school, and then the parents, right? We can get, that's how you make change and the reform that way. So if 2 out of 3 of your meals is eaten at school during the school year, 9, 10 months out of the year, we can see why we have fatty streaks and atherosclerosis in kids under 10. That's scary. We actually, if you guys came to the seminar, how many of you guys came to the seminar? You saw Texas on there for being one of the fattest states in the United States, right? That is not a good stat for us. One of the fattest states in the United States. We here in Herb Family Wellness are committed to doing better, to getting that information out to you guys. And then you guys just have to take it to your family and your loved ones and your friends and really spread the news that way. So I want to hit a couple of the key risk factors. And there may be some on here maybe that we're not really thinking of. But the first one I want to hit is subluxation in your central nerve system. I want to tell you guys, for those of you who don't know my husband's story, the rest of you know it again, but I want to tell you again. So when my husband and I first were married, my husband was and is a stud, total athlete, 6-pack abs, ran a 6-minute mile without like breathing hard, okay, carried on a conversation. And my husband ate good, exercised good, just did everything that you could think of that was right. And on the volleyball court one day at church, my husband goes down on the court. So that was almost the statistic of 1 every 38 seconds, because we almost lost my husband that day. And what they found, his heart rate would go over 220 beats per minute. Now that's not a good thing. And so we end up in the cardiologist's office, and the cardiologist says, well, after all the echo, the stress test, all the tests you can think of that they do, we did a Holter monitor where we tracked him for like 4 to 6 weeks. And at the end, he says, well, it looks like you're going to have heart surgery and be on blood pressure medication the rest of your life. And so we left there, and some of you may have heard that news yourself. We left there completely freaked out, by that information. And he was in his 20s. So he was in his 20s when we get this information. And so I'm like newly married. Now I'm going to lose my husband, and I'm this is not my future, right? This is not part of my future. And so we left there going, okay, well, we're not doing what he just said, but we really don't know what we're going to do. And that's when we met a man that was a maximized living doctor. We didn't know what that was at the time. And this man proceeded to walk us through how important it was to make sure that you understand that your nerve system, the nerves specifically in the top part of your neck and the lower part of your neck, upper part of the thoracic spine, actually go to your heart. We didn't know that. And so the only way those nerves could actually communicate to the heart is if there's a free and clear pathway. There's nothing interfering with the pathway. And what happened in my husband was a lot of interference in his spine. he had a completely straight neck from a car accident he had when he was a teenager, that he walked away with no pain and no range of motion problems. Fast forward about 4 or 5 years later, and he's down on the volleyball court. So it's not always about pain. It's really about how can I heal? Can I function? Can the nerve supply communicate with the organs, cells, and tissues? And in his case, the nerve supply could not communicate to his heart. So he was literally building disease in his heart. And the doctor, the cardiologist, wanted to, cut open his heart. And so this Maximize Living doctor walked us through how to fix this. And it took us a period of 18 months, and in 18 months, we actually corrected my husband's spine, and he has never had a heart condition since then. Thank you, Jesus. And that was really because of the wisdom that we learned of how to actually correct the spine. And that's when everything changed for us in how we practiced, how we take care of you guys. It really was born out of almost losing my husband. Sometimes things are born out of pain like that, aren't they? And so that's really what happened with us. So very important to know that subluxation in your spine's got to be that primary place that you look for when you're talking about taking care of heart disease, okay? The second thing is it's not about high cholesterol. I'm going to show you here in a minute. I'm going to walk you through the pathway of how cholesterol is made, what cholesterol is for, and why it's a hoax. Why Dr. Sherry Rogers says it's a hoax. Okay, you can hear it from the MDs. I'm just going to relay it to you guys. The next thing is low cholesterol. Many times low cholesterol is a higher risk. Low to normal cholesterol, believe it or not. Statins. We're going to hit a lot on statins today. Statins are those drugs used for what? Cholesterol. So you hear a pattern here. We're going to hit a lot on cholesterol today. NSAIDs cause a 50% increase in the risk of heart disease. What are NSAIDs?
Non-steroidal, anti-inflammatory.
That's right. So non-steroidal. So you might be taking something like an aspirin or an Aleve or an ibuprofen of some kind, and you may be taking it because you have pain. But at the end of the day, what we're doing is we're also setting ourselves up for a high risk for heart disease because of pain. So our goal is we want you to not be in pain, but we want you to be alive as well, right? So that's important just to understand that risk factor. Smoking, that's obvious. I think we all kind of know that. That's not really something that's earth-shattering. Diabetes, what's up with diabetes and heart disease? Anybody know? What does diabetes do? Yeah, it thickens the blood, right? The blood sugar makes the blood real thick, creates a lot of inflammation and plaquing in the arteries, which I'll show you here in a little bit. Overweight, obesity, poor diet, physical inactivity, high alcohol use, and high blood pressure. We're going to talk about blood pressure, though. I want you to walk away really not being afraid of blood pressure, but being armed with the understanding of what your blood pressure should be, okay? So the next thing I want to touch on right now is let's touch on cholesterol. So cholesterol is actually a waxy substance, okay? It's a waxy substance. And if you don't have cholesterol, then you cannot make hormones. Ladies and gentlemen, we can't make testosterone, we can't make estrogen, we can't make progesterone, we can't make hormones. So we need cholesterol. Cholesterol is very important, okay? We want to make sure we have cholesterol. So it's a soft, waxy substance. It is made, did it go down? Okay. It's made, your liver makes 80% of your cholesterol. So it makes it and it carries it to the bloodstream in two different kind of substances. One is called the HDL and the other one is called the LDL. I think what we try to remember in school, I remember in chiropractic school, they would say the LDL is the lethal kind. L means lethal. So that's kind of what people would remember it as. And the HDL is the healthy kind. So that's kind of, do you remember that, Dr. Gisette, when we were in school? That's kind of how they helped us remember it. But if you can see in the picture there, when the cholesterol is traveling down through the blood vessel, you can see the HDL kind of has those little balls on the end and it's just carrying it out, right? But the LDL is like these large globs and they clog up the vessel. Can you see that in the picture there? So that's what you want to have a ratio of those, but you want to have much higher in HDLs and whenever you get your labs done, okay? So cholesterol makes hormones. It also helps with bile acids. And then it also does what with vitamin D? Helps with vitamin D. Okay, without cholesterol, you can't make vitamin D. Do you guys know that? Without cholesterol, you can't make vitamin D. So if you are on a statin that's causing your cholesterol to go down, like they're trying to get your cholesterol to go down, and you wonder why your vitamin D is down, okay, see that? You're not ever going to get your vitamin D to go up because you're trying to get rid of your cholesterol. Okay, so very important to understand that particular piece. Now, there's a couple other books. I'm just going to kind of hit a few books for you guys. This book, Overdiagnosed, Making People Sick in the Pursuit of Health. This book is another really good read and just kind of understanding the hoax behind some of the things that we're being taught about health. That's not really health, okay? I want to stay on this chart here for a second. You're going to really want to chew on this chart a little bit, but it's one of the charts that's in this book, okay? And do you guys ever notice that the levels every few years of things change regarding what is healthy? For example, blood pressure should be this, and cholesterol should be this number, and blood sugar. Do you guys ever notice that? Who do you think stands to benefit when you change the numbers from, let's just say, 240 to 200? Who benefits? Okay, y'all just said pharmaceutical companies, okay? So pharmaceutical companies are the ones that benefit. It may not necessarily be what's best for us, okay? So that's why I want us to just be thinking about it a little bit. But look at what happens when total cholesterol is changed by Big Pharma from 240 to 200. We have an increase suddenly of 86% of people who have high cholesterol, right? So for the purposes of this talk, I just wanted to highlight that piece. But look at a couple of the other ones. Look at high blood pressure. When we change the numbers from 160 over 100, they changed the numbers to 140 over 90, and now that caused an increase 35%. What about fasting blood sugar? 140 to 126, increase in 14%. The bottom one, osteoporosis. This one was kind of a hit a couple years ago. I had so many women coming in saying they had bone density, low bone density, osteoporosis. 2.5 to 2, 85%. Did you know that women who take the medications for like the bone loss medication, one of the side effects, one of the main side effects is your teeth fall out. We ran into a lady, her daughter was a medical doctor, and we were at a health screening, and the medical doctor was there, but she kind of walked off, and so she was talking to my husband. My husband was over there talking to the lady, and starts talking to her about how she's on this bone density medication that her daughter put her on, and the daughter wasn't there. Can you see how awkward that would be? Mm-hmm. So the daughter wasn't there, and the lady said, I started taking this medication for bone density, and all my teeth on the right side of my mouth fell out. So she decided on her own, against her daughter's wishes, to take herself off this bone density medication. Well, the daughter did not like that. So she finds out and she makes her start taking the medication again. Guess what happened to the teeth on the left side of her mouth? So all of her teeth fell out. That's one of the side effects. This is a bone density medication, and it's causing your bone. You guys see that? Crazy. So just being aware that the effects of these lower threshold numbers, and let's just kind of think a little bit about that. Now I'm going to hit two studies with you guys and just give you the bottom line of the two studies. But just understand, these are studies with about 7,000 people, and they're about acute coronary events. So with lovastatin, the statin medication. 2 coronaries, so they took lovastatin and they took a placebo with 7,000 people over the period of 5 years, okay? And the stats show like this. In 5 years, 2.4% mortality with lovastatin and 2.3% with the placebo. Did we get anywhere? Now, what I would like the study to show is I would like the study to show lovastatin and fish oil capsule, and do that over the course of 5 years. And then not only are you giving someone sugar, but you're giving somebody good fats. That's a real study right there, okay? So we can see some benefits. Now these are with people that didn't have an event, but it was about 7,000 people. Now there was no difference. Now we have another study that they did, the Prosper trial. These are people with actually a risk. They actually had already had risk factors. Some of them had already had events, and they took them, and they're 50% of them women, older, 70 to 82, so larger, older age people that had already had a history of an event, and they take them and put them on the medication. The same thing happens. The stroke death, no difference between the statin and the placebo. The coronary heart risk, nominal difference. Cancer death, total mortality, there was really no difference between the two of them. So what happens a lot of times, the point that I'm bringing up with that one, what happens a lot of times is we have an event of some kind, and because we have an event, we kind of freak out and think that because we've had this event, we can never go off this medication ever, ever, ever. You with me? That's really kind of the scary thing. You have an event and you feel like, oh no, I'm never going to be able to go off this medication. I'm going to show you a little video here in just a second about what the body does in its magnificence when you have an event and how it actually goes about the business of trying to heal itself immediately. It's pretty amazing. So the truths about cholesterol. Dangers of cholesterol medication. Number one, it causes liver damage. Okay, so this medication causes liver damage. Number two, it causes a neuropathy. What is a neuropathy? So I like it. You know this because you know this. She's going to teach the class next time, right? Let me just add one piece before you answer. Cholesterol, your nerve system is made up of mostly what? Fat, cholesterol. So if your brain and your nerves have to have this fat cholesterol substance around them, and you take something that tries to lower it, can you see that suddenly you have set your brain up and your nerves up to be weak and have problems like neuropathy? Now, what is neuropathy? Nerve damage. What are some symptoms that show up with nerve damage or neuropathy? Okay, see what she said? I like where you're going.
Howling pain, which is what my dad does every day.
Yeah, howling pain. You're getting real. What do a lot of people complain about? Their feet hurt. They have burning and numbness and tingling down extremities. So it goes down into their extremities, into their hands. It also goes into their feet. That's neuropathy. How many people do you know that have that? Just a few. Just a few, right? So can you see how this cholesterol medication could be maybe a primary cause? Maybe. Or an aggravating factor. Okay? Now, next, severe joint pain and ligament rupture. So joint pain and ligament rupture, one of the primary causes, or I should say side effects that I hear with people that are coming here on statin medications, their hips hurt like crazy. They got this weird leg pain and hip pain. Like those are one of the primary things that we hear a lot. Amazingly, they're being told to be on this medication and now their joints are wore out and they're giving them trouble. Muscle wasting and atrophy. So if cholesterol medication causes muscle wasting and atrophy, can you see how it might cause heart failure? Because your heart is actually a muscle. Limits the protection of cholesterol against cancer. So with cancer, we need to make sure we have good fats. What does cholesterol do? It's this waxy substance that shows up in an injury. It's going to show up on the scene anytime you have an injury of some kind. It's actually the liver is going to produce more cholesterol when there's an injury. That's the beauty of how God made us. Like he set this whole system up to keep us safe, to protect us when we come upon an injury. And the liver's going to work overtime to produce more cholesterol. But if you're taking a medication, you can't do that, right? It creates depression. I'll show you that here. Stops CoQ10 production. Do you guys know the story with CoQ10? I'm going to show you just a minute. CoQ10, if you know anybody on a statin, number one, have to be taking CoQ10. Must be taking CoQ10. So what does that do? Cholesterol drugs increase heart attacks. Researchers followed 114 patients with heart problems who began taking cholesterol-lowering meds. They found that every point of decrease of serum cholesterol, every point, there was a 36% increase in the risk of what? Death. So every point you're like, yay, my cholesterol numbers are down, but I'm dead. Do you see how that, like, it's just kind of like messed up, the thinking. But we get fixated on the wrong thing rather than just looking at the total body as a whole and realizing that, man, we can be doing one thing and thinking that these numbers look good and really harming ourselves somewhere else. So this is the danger of cholesterol medication. This is another piece, okay? So what did I tell you your brain is made of mostly? Fat. So they're saying, I don't know if you guys have seen or heard the diagnosis, but there's a diagnosis with a CPT code called statin-induced dementia. The doctor knows they gave you dementia. They're giving you cholesterol-lowering medication so that you can get your numbers low, but now you can't remember a thing. Now, has dementia and Alzheimer's type diagnoses been declining or has it been going up? And now I just showed you the stats on how we changed the numbers from 240 to 200 and how many more people actually are taking cholesterol-lowering medications and getting a diagnosis. Do you guys see how the rabbit trail kind of goes? So this book, this guy was actually an astronaut, started taking it and completely lost, like, dementia. So brilliant person, right? And gets dementia because of this Lipitor theory. So the dangers of cholesterol medication and a couple of the problems here. The pathway here I want to walk you through. So statin drugs, stay with me. I'm going to read a little bit here for just a second. So work by inhibiting a vital enzyme that manufactures cholesterol in the liver. Pay attention to the HMG-CoA. So HMG-CoA. So it inhibits HMG-CoA. You guys with me? Okay. So the liver can no longer make cholesterol when you stop that particular enzyme. That's the whole premise behind lowering it is now we stop that, so now we can't make cholesterol. So what's the problem? Your brain tissue is made up of 60% cholesterol. So if you lower it, the brain nerve system begins to deteriorate. You block serotonin uptake sites, which decreases serotonin and causes what? Depression. Has depression gone down or has it gone up? See how we're manufacturing a lot of different diseases so that we can make more money for big pharma? It's a big lie that we're being told. Okay? Now, next problem, CoQ10. So CoQ10, a major, very, very, very critically important antioxidant. It's needed to transfer energy from food to our cells is inhibited when you take statin drugs. So hang on. It's needed to transfer energy from food to our cells. It's needed to transfer energy from food to our cells, and it's blocked when we take statin. So can you see how we might have a problem with energy? Fibromyalgia, any other energy issues, right? CoQ10 helps reduce inflammation and protects from cancer and aging. It's a primary building block for the cells of your brain, your nerve system. So if you're taking a statin drug, can you see why you have to supplement with CoQ10? Like, there's no negotiating there. That is a must. And also really vitamin D, because we just killed that pathway. Now I'm going to walk you through a little bit of science here, okay? So I'm not going to expect you to remember to read any of these or to really memorize or say these words, but I just want to walk you through the pathway a little bit. Cholesterol is synthesized in the liver. Here's the pathway. Here's what it looks like. If you can see, then what I want you to see is that HMG-CoA. Everybody see it at the top? Okay, HMG-CoA. Enter statin. And what you have is a blocked pathway. So now we've got a blocked pathway. So HMG-CoA, we got a blocked pathway. So statin inhibits that HMG-CoA. One more thing I'll kind of add to it, just a little bonus piece, would be another super important mineral, magnesium. It regulates HMG-CoA. So that's why a very large percentage of hospital events where people show up at Parkland have to do with magnesium deficiency. So if you can make sure you've got magnesium and never go off magnesium and always make sure you're taking it, you can actually decrease your chances of ending up in ER with a cardiac event that they end up saying go home for, okay? So making sure you're taking magnesium. Now what happens in this pathway is you block, HMG-CoA gets blocked. Now we can't make cholesterol, and CoQ10 gets blocked. Can you guys see that, how that works right there? So you block that, you can't make cholesterol. Now what did I say cholesterol does? It makes all your what? Your hormones. No testosterone, guys. You want to know why so many clinics are popping up low T? Think about it. Is low T popular right now? So if you're on a cholesterol lowering drug called a statin of some kind, man, those guys are running into the low T clinics. Can you see that? They're running into the low T clinics. So cholesterol, what else does it do? Bile salts, right? Bile acids. And then also cholesterol does what? It shows up, it helps to manufacture vitamin D, right? And then it comes in on the scene when you got an injury. So can you see how you're just like, you're totally leaving yourself in a very vulnerable state, okay? Now I want to walk through, just show you a real quick how this whole cholesterol process, how you can see cholesterol at the top. And without that, when we talked about the hormones, then kidneys can't do what they're supposed to do, liver can't do what it's supposed to do, the ovaries can't do what they're supposed to do, and testicles. You see all those hormone pathways are completely shot, like you can't. And so then guess what? We get to go into the MD or the female doctors, and we get to get all our hormones checked, and we get to find out that what? All of our hormones are what? Low. And then guess what we walk out of their doctor's office with? A prescription for pellets or something, right? Yay, and I'm taking bioidenticals and all that, right? I'm being sarcastic and a little facetious because, like, they're building a business and they're harming us in the process, okay? I'm not trying to be ugly toward y'all because we've all been lied to. It's really because, dang, they're really building a huge business. This is massive. All on, like, look at where the pathway started. We block cholesterol, and dang, we create low T clinics. We got, bioidentical. You see where all that goes? Like, it's just like this major pathway. Now, what should blood pressure? Okay, I need some examples. Let me think. Dr. Gisette, I need you. Bobby, I need you. I won't divulge anything. I just need you for a second.
Oh, that's okay.
Okay.
I had blood pressure this time.
I'm gonna make you stand here now. Okay. Now we're talking about what blood pressure should be. Okay. Does everybody know what normal blood pressure, what they've been told normal blood pressure is? 120 over 80? Okay, that's pretty much the standard across the board. Now they're going to change it again. It'll be 100 over 50 pretty soon. Okay? I'm being sassy, but not really. Okay, so would it be normal for Dr. Gisette and Bobby both to have blood pressure of 120 over 80? Would that be good? Would that be good?
No.
Okay, everyone says no, but do we know why? We don't know why.
Because it has farther to go and Bobby.
It has farther to go. So he's got to get the blood out of his feet, and it's got to have enough pressure to push it through this. I'm being nice, I love you. Right? It's got enough pressure through this, right? And to get to where? That's the goal. It's got to get here. We got to preserve the brain at all costs, right? Would it be? Would it be? Would it be? You said that's why it needs to be what? It needs to be a little bit. So for him, if we took his blood pressure, would we say that that would be his body doing the right thing by having a higher blood pressure than those numbers?
Yes.
So you're saying to me, all of you, okay, that if his blood pressure was, let's just say, I don't know, well, give me some numbers. Give me some, no.
I don't mind.
What?
140 over 85.
Yeah, or what if it was 160 over 100? Would that be the body doing the right thing to get the blood to his brain? But the doctors do what? Oh no, that is not good. But can you see why when you take a blood pressure medication, that if your blood pressure is that for this body mass, let's not talk about anything that you got going on, I'm just doing my example here.
Gotcha.
But can you see why if you put him on a blood pressure lowering medication, that you could set him up for what risk?
Low blood pressure.
Dementia.
I like where you're going. Dementia, but what else? Death. Why? Because he might pass out because he's not getting blood oxygen to his what?
Brain.
Okay? Now, let's come back to this one. Do we think that this should be 120 over 80 here? Could be lower. Probably more lower. Is she a textbook?
No.
Probably not.
Nobody is.
Right. Okay, we're getting on the same track here. Probably more so like maybe 95 or 100 over 50 or 55. That might be accurate for her, right? But let's just say we put her at 300 pounds. Okay, 300 pounds. What now should her blood pressure be? Should be higher. Would that be normal? Okay, now let's go back to all the risk factors, right? There are things that we should do to decrease the body mass and things like that. But keep in mind, the body is going to preserve the brain at all costs. The brain is the primary objective. It's going to preserve the brain at all costs. So if that blood pressure being high is what is accurate for someone who has more body mass, then why are we messing with it? Why don't we take care of the other factors, right, and make sure the brain is okay? You guys with me? That's really all I wanted to share with you, because I wanted to make sure you guys think about this a little bit rather than get really nervous about some of these numbers, because they're going to throw out numbers every few years. And those numbers may not necessarily accurately reflect what is healthy for you. It may more likely accurately reflect the bottom line of how many more prescriptions that they can write. Okay? Okay, good. Thanks, guys. Was that good? Round of applause for them. Okay. So that's really what I wanted to hit on that. Now, causes of heart disease. Okay? I want to just show you what happens in a normal arterial wall. You can see the normal arterial wall is open. The blood can get through when there's a normal arterial wall. When we get into a narrow artery because of inflammation, maybe because of diabetes, maybe because of, inactivity, maybe because eating too many Chick-fil-A's, maybe, right? Some of those, anybody? Chick-fil-A? Nobody? She puts her head down. Right? Maybe doing French fries, whatever that is, right? So we narrow the lumen, then we can't get enough blood through there. The next thing, totally occluded. Okay, we got scar tissue in there. And then the last one, aneurysm, which I showed you. The blood's going all the wrong directions. It's the vessel's getting larger, right? The blood's going all different directions. I want to hit one thing to you regarding this, these blood vessels here. Inside the blood vessels, there are 3 layers. The tunica intima is one of the layers, the inside layers of the blood vessel, that when you take birth control pills or do whatever the birth control, things are that they have that have the hormones in them, it actually totally destroys this layer, tunica intima, destroys it. So if you take hormones for those reasons, you know that they put that on the inserts, right? The inserts say you're at risk of, when you take birth control, of having a stroke. They say that those are risks on there if we read the inserts, but that's what they say. But why? I'm just telling you why. It destroys one of the 3 layers. If you destroy one of the 3 layers, can you see how you leave the vessels weak? Leave them all weak? We don't want to leave our blood vessels weak. That's super important, okay? So this picture just kind of gives you a picture of how the whole artery, the causes of that. Now I want to have you listen to this video here.
In this short film, made during an angio, the right coronary artery at left hand will be filled with contrast medium.
So this is the heart, and I want you to pay attention to the blood vessel on this side.
Before we start the film, I want to show you the most important result of this examination in advance. You can see a severe narrowing, a stenosis, in the midsection of the artery.
See the stenosis? You guys see the middle?
Now let us take a look at the angio.
So they're putting a contrast medium in there, and they're looking to see where the stenosis or the narrowing is.
Let's watch the film again.
So this is the heart muscle and the blood vessels to the heart muscle itself.
I will now show you a series of photos taken from the angio so that you can study the procedure in detail. Here is the first photo. At the upper edge of the picture you see the heart catheter with its curved end still empty of contrast medium. Now the contrast medium starts to appear. You can see the roughly S-shaped form of the upper section of the artery, marked by contrast medium.
The top.
This is the most intriguing photo. Why is this? The most important feature is the dark strip marked at the bottom left of the photo. This shows contrast medium in a section far beyond the stenosis. Nothing can yet be seen of the narrowing itself. Despite this, a section of the coronary artery far beyond the stenosis is already filling up. Here for the first time the stenosis, circled, appears.
You see that? The separation, like there's nothing
This
going
is
through?
the same photo. The narrowing can be vaguely recognized due to the descending flow from above, but mainly as a result of the ascending flow from below. Things now become clearer. This stenosis hardly allows a single drop of blood to pass. The stenosis allows practically nothing to pass. It's not the case, as a layperson might assume, that the blood somehow manages to squeeze
This is
through
really
the bottleneck
powerful.
and struggles to fill the lower part of the artery. Yet, it is exactly this section beyond the narrowing that is well filled. The blood must come from somewhere.
Where's the blood coming from?
Even if the collaterals, the vessels that make a detour around the stenosis, are not clearly seen, these photos are proof of their existence and effectivity. This is a perfect illustration of a 90% stenosis. However, This method fails to provide decisive information. It's not possible to show the extensive network of collaterals using the heart catheter. This leads to considerable false interpretations regarding the importance of coronary artery stenosis. In the very small narrowing, a little blood forces its way from above and a little from below. The blood in the stenosis is stagnant. If the narrow passageway is closed completely by a blood clot, a thrombosis, what happens then? Does a heart attack occur, as generally assumed? By no means. The blood is already standing still in the stenosis. A complete closure would have no effect. There's no alteration whatsoever. There can be no better illustration. The blood supply to the heart muscle beyond the stenosis is completely unaffected. The right coronary artery is clearly and powerfully displayed far to the regions of its finest branches. The stenosis does not damage the heart.
The stenosis does not damage the
Familiarize
heart.
yourself with these invisible collaterals. Do take another look at this short film.
Okay, so
Where does the other blood come from?
that's a good question. Let me just tell you. What is the procedure that they usually do when they say there's like 90% blockage? They put a stent in there, right? So the idea with a stent is what? It opens it all up. But what did the body already do?
They already found another route.
In the majesty of how God made us. Oh, you got a problem here? We already built an entire network of collaterals to supply and feed and support the heart so there's no damage. You guys with me? So many times the damage is in the medication and the stents that they put in there. But yet, this guy is saying that is false how they're interpreting this stuff. The body has already created all the collaterals. They actually saw it by the contrast medium. They had to take a contrast, right? And the contrast went everywhere blood supply was, and it actually fed the heart. It created a whole nother blood supply, blood circuitry system. Is that amazing or what? That is just the majesty of how God made our system. So how do we overcome this stuff? But I think right away, I think you guys already caught a few things, did you? What are a few things you think some of the action steps right away are? Anybody? Okay. Don't be ignorant. Isn't that what you said? Or stupidity? Don't be stupid. So the first piece, make sure your nerve supply is clear. Work on this. If you're not doing a good job in this area and you feel like you could press in a little harder, press in harder. If you need a little more help, get some help. If you haven't been checked yet, get checked. Because this piece literally is what saved my husband's life and countless other people. We have had people move and go to other states and they wanted to go move and go live somewhere else. And when they got somewhere else, they had no one like us to take care of them there. And their health was going downhill. So they sell their house in Utah and come back. Like this happens quite often because when you get your spine and nerve system taken care of, this can be the single most thing that actually saves your life. It did for my husband. So the next piece is the nutrition. Which eating plan should we follow for the nutrition? What eating plan? Does everybody know what the 2 eating plans are? Chick-fil-A. Mr. 21-pound weight loss, right? He does know. Whataburger's my new kind of, But Dr. Wolfson, that's the cardiologist, he actually tells people to eat the advanced plan. That's paleo. He tells people to eat the advanced plan. So what macronutrients should we consume the most of? Fat, protein, or carbs? Which one? Fat. How much fat? 65 to 75 would be good percent. So keto or advanced plan, kind of in that realm. And what are the fats you should consume? Not Chick-fil-A. What are the fats that you should consume? I'm giving you a cheat. You can look at the cheat. avocado, coconut oil, olive oil. What did you say? You said something. Nuts and seeds, right? Now, not the nuts and seeds that have M&Ms in the package. Busted. Right? I busted you, Bobby, didn't I? Right, so nuts and seeds, make sure they're good fats. The proteins really should be around the 25% mark of your proteins. What kind of protein? Grass-fed. Free range. If you guys are Bible scholars, we literally today in our study, didn't we today, Dr. Gisette? We went through, do you remember what the scriptures were? Leviticus 10. If you want to go to Leviticus 10, it actually tells you what God told us, what fish or what in the sea, what animal or what creatures in the water, on the ground and in the air. It's the advanced plan. Like it's just, it's so cool, yeah, Gisette? It's so good today. So this is going to be the way that you want to eat. And then the carbs. What carbs should you have? If we're trying to overcome heart disease or prevent heart disease, or we follow the advanced plan, if we are following the advanced plan, then we're going to want to stay away from what? As far as carbs are concerned.
Bread, pasta.
Grains, yeah, we're staying away from grains. You said pasta, so the pasta, but you know they do have a pasta that has chickpea pasta that's at Natural Grocers, so they are starting to have some stuff like that. But we want to stay away from the bagels and the rice and the noodles and the pasta, that kind of stuff, right? Just because it's clogging up and creating those lumens to be inflamed, not like they're open, the blood vessel's not open, but it's inflamed and we can't get much through. That's diet. We can handle that. We can handle that by the stuff that we're doing. We can make some changes in our lifestyle by doing that. And if you need help, that's what we're here for. So the eating plan is really important. Also, if you haven't checked out our website, Herb Family Foods, there's a whole bunch of recipes on there. This book, there's a ton of recipes. My kids did some videos on there, so some of them are instructional, like if you want to watch my silly kids, but they're really instructional. They're really good. They did a great job. So there's some videos on there. This book right here, in the back in the appendix. Appendix B is advanced plan, and C is the shopping list. And then Dr. Gisette took everybody shopping on Friday at Natural Grocers. It was a great group out there. Anybody from here go? Great group. So good. And right away, somebody made a recipe and she doesn't even ever cook. Did you guys see the post? She doesn't ever cook. What was that? Chile. Yeah, I mean, just so good. And her fiance went for seconds. She was pretty excited about that. It's a big deal when your fiance likes your cooking. Okay. The bundle. Couple the reasons why these particular products are in the bundle. We hit magnesium already. Everybody good with that? Everybody feel good about magnesium? Make sure you're getting magnesium every day. Everybody clear on the CoQ10? Okay. Everybody's clear on the vitamin D? Now, the optimal omega, that's going to be your balance of your fish oils, your 3s and your 6s. That helps to counter inflammation that you have, especially if you have had Chick-fil-A once in a while. Okay? Daily Defense. Here's what's so good about Daily Defense. That is a major anti-inflammatory antioxidant. Okay? It's got curcumin in it. It's got Indian gooseberry and melon extract. Those are really powerful for antioxidants and anti-inflammation, which is why it's part of the heart bundle. And so you'll see it in this high blood pressure prescriptive as well. Exercise piece. The exercise component, how many of us are committing to exercise more? Big hand. Give me a big hand up there. Exercise. Why? You know, when you exercise more and you suck in more oxygen, it helps to heal, helps to keep that heart muscle strong. High intensity exercise is the best because you're actually sucking in a lot more oxygen rather than just standing on the treadmill, checking it off the list that you did it. Okay? Get that exercise component in there. That's part of the healing for the heart muscle. And then I want to just this is just a quick little pathway showing you how cholesterol, could sunshine lower your cholesterol? Cholesterol with sunshine turns into vitamin D. So sunshine is super important. If you live on the equator, people on the equator actually have low cholesterol. Did you know that? They have low cholesterol because of all the sunshine that they're getting. Anybody have a tiger in your room? A metaphorical tiger in your room? Right? The stress of a tiger being in your room that you kind of hang out with and let it stay there with you all the time, and it speaks to you and it growls in the corner, right? Anybody have a tiger at work or in your bedroom? Right? So we don't want to keep tigers around. We want to get rid of the tigers. What the heck is a tiger in your room? Is it disorganization? Is it piles of stuff everywhere? My closet was a tiger before the seminar. It was a tiger. I said as soon as the seminar was over, Saturday I finished Sunday my closet got clean. It was a tiger. You got to look at things that are tigers in your life. De-stress and rest. Meditation. I love that, just that time, being still and being present with the Lord, getting exercise, getting sunshine, just being still. Being still. And then what else? Sleep, right? Sleep. There's a study on sleep and the importance of sleep. 7 to 8 hours is really the best, okay? So if we can kind of gear toward that direction, make sure we're getting more cholesterol. And then this is the Wolfson family. I told you that's the chiropractor. She's a rock star, and he's a rock star, but I think she's the bigger rock star, just saying. But that family, they're the ones that are in Phoenix, and he's that top doctor I told you about that is the cardiologist. If you want to follow him, if you know somebody who's dealing with heart stuff, dig into his stuff, because everything that he's saying, that's when I was telling you he does the 10 health commandments. Get responsible, that's the advanced plan. Get sunshine, get sleep, get active. Guess what else he says? Get hydrated, get chiropractic care. He actually won't take you on as a patient if you're not getting adjusted.
And it's cool to see number 2 is sunshine because they're in Arizona.
Right? Right? I think that's pretty brilliant for how many cardiologists do you guys know that tell you to make sure you're getting adjusted?
Zero.
Right? That's because he went there. Get rid of stress, get away from toxin, get grounded, get quality supplements, and then make sure that's the spine nerve system component. So that's it, guys. Does anybody have any questions before we wrap up? Was this helpful? Okay, good. I'm here if you guys have any questions. Be blessed. I hope this opened everyone's eyes. That's really my goal, is that it opens your eyes. You make different decisions about how you handle your health care. You communicate to your loved ones. Hopefully the video will work and we can get this out to everybody so you can kind of watch it later. So I'll be here if you have any questions you need. Otherwise, be blessed.